I'm afraid he was going to go Cardi B because that's his favorite thing.
Oh, no, don't do that.
There we go. Nice.
She has some good things like
don't even.
I'm not going to do it.
We all.
I know you have something to say about
on my own competition. I'm competing with myself.
Yes. Welcome, everybody. Thanks for another episode of the Black Student Success Podcast, where we bring insight and guidance from successful Black professionals. My name is Selvin.
I'm Ashley InQuire.
And we appreciate you listening today. So today we're going to bring on our guests, Patrick and Nancy Emelife, who are both doctors and in different specializations. And they're going to talk about their story and how they got onto their journey up until the point where they're at now with all the experiences they've had and, drop some knowledge for us. So let's welcome them. How are you doing today?
We're living the dream.
Doing good. Thank you so much for having us. We're excited to be here.
Yeah, thank you so much for being here. So let's go ahead and jump right in with our first question. We love to ask this question. It's your time to boast. You deserve it. You're successful Black professionals. And so we could start with Nancy. Nancy, go ahead and describe yourself. Who are you?
Yeah, so I'm a physician. Specifically, I'm a radiologist. I specialize in breast imaging. So just generally, a radiologist is a kind of doctor that specializes in the interpretation of different images for the purpose of diagnosing disease. So, anything from people hear about x-rays or CT exams. So I'm the person that reads those things and then diagnoses whatever illness there is. I have a specific specialty in breast imaging. So I specialize in interpreting things like mammograms for diagnosing breast cancer and detecting breast cancer. So that's my spiel. That's what I do.
That's awesome. That's pretty good. That's amazing.
Okay, that's legit.
I guess you have a lot more to say.
No. I wasn't sure if this is where we also talk about our background or not.
You can if you will. We'll get into that next. But go ahead, Patrick. It's your turn. Yeah, it's your turn. Who is Patrick?
So I'm Patrick. So I am a husband. I'm a father. I'm actually an anesthesiologist. I had an interesting route because I actually was doing plastic surgery for 3 years before switching to anesthesiology. I'm currently doing a fellowship in regional anesthesiology and acute pain medicine. And what that is specifically regional anesthesia. That's where we do nerve blocks on different parts of the body, so that you can have surgery without us giving you general anesthesia. That means we're not putting a breathing tube down your windpipe and we're not giving you gas to keep you sedated. Instead, you just have this nerve block in your arm or your foot is numb for the whole surgery. And we just give you some medication to help you feel, give you some medication to sedate you. And that way you can wake up faster from anesthesia. You have less complications. And it continues on because after the surgery, if we put a cath in place or a little tube in place, you can have pain relief for up to 3 days without needing to take any oral medication. The acute pain medicine part is just means I take care of patients with new pain or just pain that happens after surgery. And that could be in the hospital or when they go home using these nerve practices.
All right, so let's go to your backgrounds a little bit.
Yeah, so let's start with you, Patrick. What did your childhood look like? What are the dynamics that you had within your childhood, and what type of support did you have, as you were growing up?
So I grew up in San Francisco, California. Pretty much, my parents have been role models for us, but they never pushed us to do anything. The only thing I can say is growing up, I just remember seeing a picture of my dad's graduation from college, really with mass. He never even told me about it, but it was just hanging in the living room. So I guess that was a subtle way of kind of telling us what we should do. But really, the only thing he told us and was whatever you choose to do, make sure you're the best at it. So if you're going to be a comedian, make sure you're making everybody in this household laugh. Obviously, I'm not the comedian, so that didn't work.
But you tried.
I tried. So I'm actually the first of 5 in the family. I have 3 younger sisters and 1 brother who's the youngest in our family. I was pretty involved in our church growing up. In terms of my background or where I went to school, I went to a public school. Actually, I was in public school the whole time. I went to Lowell High School in San Francisco, which is a public magnet school. Later on, I'll tell you some more details about some interesting things that happened while I was there and how that it affected me. After high school, I actually went to a community college, and I took all my prerequisites for med school at community college, and then actually took my MCAT and then transferred to Stanford. So at Stanford, I was purely there to get a degree since I already had what I needed to start, or essentially go to med school. Then, like I said, I ended up going to Pittsburgh Medical School, University of Pittsburgh in Pennsylvania. And then originally I matched into plastic surgery. So with regards to this match process, unlike medical school or college, you can't just pick where you want to go, but you rank all these different institutions and they rank you, and wherever the highest match is, that's where you end up. So I ended up going to LSU in New Orleans, their medical center for plastic surgery, which was great. I love the program. However, as I was doing plastic surgery, as I did plastic surgery and I thought about the goals and things I wanted to do outside of me, it pretty much collided because my schedule was so unpredictable that I couldn't imagine like having a family and doing some of the things that we're doing now, So I ended up switching to anesthesiology, and it was probably the best decision of my life, besides marrying you.
She's number 1.
Good save.
Very good save.
But yeah, now I'm doing a fellowship in regional anesthesia and acute pain medicine, and in about 6 months we'll be going to Northwest Indiana, and I'll be the director of regional anesthesia at a hospital out there. That's my background.
Nice. So you've been all over the place.
All over, just
Yeah.
So me, I as far as just background, I grew up in Texas, and actually I'm the youngest of 7 kids.
Oh my goodness.
Family.
Woo.
Yeah.
Oh my gosh. Nice.
So, all in kind of Dallas-Fort Worth area, and kind of growing up, as the youngest, I was always like the quiet one, and but always knew that I wanted to, I was always ambitious, and so like thinking about what I wanted to do in life, going to medical school, I didn't really start thinking about that until really college, but I knew that I wanted to do well in school, and I worked really hard in school. I think overall, just kind of growing up, we were, very humble beginnings. My parents were both immigrants, and we didn't have a whole lot growing up. So I knew that my motivation was to like create a better life, ultimately for like my mom. Like I always wanted to do something big for her. So I knew I wanted to be successful because I wanted to give back all of the sacrifices and all of the things that, they had given to us, kind of moving across the world and starting a new life. So that was sort of my motivation, throughout my life up until even this point. But I mean, I guess we can get into the specifics about medical training and all of that. But that's sort of, where I came from and sort of my big picture outlook on.
How did you know you wanted to study medicine? And was this an area you initially felt supported in by friends and family?
Yeah, no, I'll start. So I did not know I wanted to do medicine. I actually went into college at wanting to be a physics major. And so it wasn't until like the end of my first year that I started thinking about medicine. And I was still open to, whatever. So I remember just volunteering in different groups of things in college. And then I volunteered in the ER. And that was, I think, the turning point when I started to think about medicine, just more generally. Even though my first experience wasn't great, I almost passed out.
Oh, no.
that was when I started to think about medicine, and then just sort of exploring it from there. Saw that I really liked the opportunity to sort of help people in that way. Started thinking about it, and yeah, then I was sold after a couple of volunteer experiences.
Yeah. So did your friends and family feel like this was a good idea for you? You know, did they give you 2 cents?
I think that a lot of college students go in like wanting to be pre-med, and fewer decide later into their college careers. So like when I started, because I didn't want to be pre-med, I didn't really have that group of like friends that were like on the medicine. Yeah. So I felt supported by my non-medical friends, but I wasn't surrounded by that high stress pre-med group that you often hear about. So and overall my family was happy, whatever I wanted to do. So yeah, I felt
good. Great. What about you, Patrick?
So it was never really on my radar. I am more of a engineer, artist type of person, and I started off wanting to go into mechanical engineering. And actually, for the first 2 years, all my classes were engineering classes or sciences, the hard sciences related to that. My ultimate goal was to be the guy who designed your cars. And I still will do that one day. But
he wants to do everything.
In time. Mm-hmm.
Exactly. But how I got into medicine was really when my grandmother came from Nigeria. She had pulmonary fibrosis, which is a lung disease, like you get scarring of your lungs. She also had diabetes. And I remember one day, this was in the weekend or something like that, but I remember my grandmother like falling asleep on the couch, and we thought she was sleeping. But I remember us trying to wake her up, and she didn't wake up, and called the ambulance, called 911, found out that she was in a diabetic coma or a hypoglycemic coma, so that's when your blood sugar is too low. And within 2 weeks, she passed away. And that made me think about human life, but even more so, it made me think about I've heard many stories about other family members going to like Europe or America to have their health care. And I was like, man, like, why can't we have this stuff in like Africa? There should be this stuff there. And so that's how that started for me. And the further along I went, the more I started to realize, well, we have a jacked up system here in the U.S. too, and we're seeing all the problems here now, or at least the light is being shed on it now. So I'm really like my ultimate goal is to change healthcare and health policy here. But in Africa, there's still that goal, but there are actually some bigger things that need to be done first before that's a reality. Like I think there needs to be sanitation system and water and constant electricity before we're even at the stage where we could actually have a true healthcare system in some of the other countries. So that's my goal. I know there are some people who are working on those things. So I think right now my focus is more on the U.S. Healthcare, and I think that's what I'm familiar with. As far as support, my dad didn't. My dad's like, do the best, whatever you want to do. My mom didn't want me to do it. She's a nurse, so she saw how stressed out these doctors were, and she didn't want me to suffer, So she actually advised me not to go into medicine. She recommended pharmacy, and for a moment I flirted with the idea of that, But at the end of the day, as I started shadowing doctors and volunteering in the emergency room, I felt that my pull was truly medicine. And then since I was in the engineering classes, fortunately most of the math and the sciences overlap. So I just had to add on the biology stuff. And once I did that, I pretty much was set to go. At the community college, we didn't have, or at least, where I went to community college, we didn't have like a pre-med advisor. So I did a lot of the research myself, and I took it upon myself to like find somebody who was like anywhere from 1 to 10 years ahead of me, and I picked their brain. And I mean, kind of like you were talking about, like they were not necessarily all black. Some of them were women. It wasn't until med school that I actually started seeing people like black mentors and people that looked like me essentially. But I had to plan everything myself, you know, and um, I don't know. It's just, you know, I guess being the firstborn, I kind of wish I had a older brother or sister, but it did force me to like find that older brother or sister, and it forced me to really take the lead in planning out my future.
I think that's one of the things that we both noticed is just kind of we were both the first in our families to be doctors, and so we didn't really have a lot of guidance from others. And you know, entered medical school, we talked to our classmates, and a lot of them had parents that were doctors or older siblings or uncles or had all of these resources that we felt like we just didn't have. So I feel like a lot of the time it was difficult to figure out things like job contracts, even especially, or just anything related to medicine if you didn't have someone that you could directly ask or someone you knew who had done it that was close to you.
Yeah, and in this field, it seems like it's so layered, and there are so many things that you just have to know. And if you don't know what to ask, it's kind of hard to even avoid certain situations. So I'm so happy that you guys both like reached out, and you guys are both go-getters, and you found your mentors and your support as you continue through your college journey. So that's pretty darn good. All right. Go ahead. So.
Yeah. So, I mean, I know you both talked about a lot about what your college experience was like. Was there anything else that you want to add about your college journey, what med school was like, and what those paths look like?
Yeah, I'll let you have a lot.
So I guess before I get to the med school thing, hopefully I'm not cutting into the time, but I want to just highlight for me, like before I went to high school, I was middle school, and I always thought of myself as, I felt like I was doing what I was supposed to be doing. But I got made fun of it a lot in middle school, and like it affected me negatively. So even though I went to the public magnet high school, my first 2 years there, I purposely cut classes and did all this stuff just so I would not have the label of being a nerd. So that really, like, when I say traumatized, it kind of, it did traumatize me in a way. And it wasn't until my, I guess right before junior year, I actually went to Nigeria. And when I was in Nigeria for a month, I remember seeing my cousins, and they were like dejected and disappointed. And I was like, "What's going on?" Well, it turned out that the professors in college were on strike because the government, they weren't paying them their salaries, so they weren't sure if they were going to graduate college. Or even, they weren't sure if they were going to graduate college, So then it made me kind of think, and I'm like, man, I'm here in the U.S. and I'm getting this education for free, and I'm just kind of playing around with it. And then, so that made me rethink my path, and it kind of made me think about, I guess, ignoring or not caring about what other people think about me. And then when I actually got back to the U.S., friends started talking about college, and I'm like, will I even be able to go to college with the grades that I had? Like, it was like 2.0 or no, it was about 2.0, something like that. And it wasn't that I wasn't smart, but it was just I don't want the label, so I purposely didn't do my work and all that stuff. So when they started talking about it and people started talking about SAT and all that stuff, then I started to like take my classes seriously and taking AP classes and honor classes, and I did well. I did 4.0 my junior year. But when it came to applying to college, it was already too late, Again, I wanted to go into engineering, and that's an impacted major, so it's already very popular, and you get to be a standard deviation above like the other applicants. So I just remember applying to all the University of Californias and just not getting into any of them. I got into like San Francisco State, but I didn't want to live at home. I wanted to have the on-campus life experience. So I was a little like depressed or something like that. I just didn't feel too good about anything. But I am glad that I had this family friend. We actually went to high school together. Her dad was in the financial, I guess he's a financial analyst, and he told me that told me not to like worry or still have hope. I was like, why do you say that? And he said, well, a lot of his colleagues went to a community college first, so like you don't have to just go to a 4-year college. Like a lot of people start their journey off at a 2-year college or a community college. So that kind of gave me hope. And sure enough, when I went to City College of San Francisco, to me, that was my second chance. That I came into that institution with my mindset being, I don't care what anybody tells me, nobody can stop me. I know what I want to do, and I really did like ace all of my classes, and you know, they actually hired me as like a tutor for organic chemistry, also physics TA. I got involved with the NIH scholars program. So I learned how to do research and all that stuff in the community college setting. But not all those things came like easy. Like I had to look around for the NIH scholars or that scholars program. But when I did transfer to Stanford, it was like completely different. Because at Stanford, they just give like they're emailing you about all these different opportunities. It was just like whatever you want, here it is, you know, just apply, you know. So it was a completely different experience. So, you know, when people ask me, this going to a college, does it matter where you go to school? I say yes and no. I truly believe it doesn't matter where you go as long as you make the best of your situation.
Mhm.
However, you have to also know yourself too. You know, some people know that they need a little prodding, and if you need that, then make sure you go to a school where you have those support systems. You know, Stanford was great. You know, I met a lot of people that I never met like at community college, and there were so many rich experiences that I had there. And kind of even there, they have a pre-med program, but I didn't really even use it because I was already like done with what I needed to do. So back to my point, you know, just do the best wherever you go, you know. And if you feel like you're missing out on something, reach out, you know, look for mentors. You know, if it means asking your professor, they know people. You know, like honestly, I wouldn't have gone to Stanford for my chemistry professor. He was the one that recommended that I apply. It was never on my radar. So, yeah, that's the college part.
Yeah.
You kind of take over medicine, and because it's almost similar.
Oh, as far as just, you know, no, I think you make an important point about just doing the most that you can with the resources that you do have. I think a lot of us, you know, in the medical profession even get caught up in going to the big name schools or doing this and that. But really, if you work really hard wherever you are, you can succeed and you will succeed. We often talk about, you know, a lot of our best professors come from all over the world, and it doesn't really matter where you come from. It's just about what you do about the community that you have. So I think kind of to add to that. As far as like my medical school journey, so I guess I can get into a little bit about, you know, where I went to med school and kind of that journey. So like I said, I started, you know, college not knowing I wanted to go into medicine, made the decision late. So when I graduated from college, I actually decided to take a year off in between medical school and in between college and medical school to do just a little bit of research and kind of make my application stronger before applying. So that's what I did. So I did a year of basic science research, which was good. Then also gave me a chance to sort of work on my application and finish that. So I went to medical school in Texas, University of Texas at San Antonio, which was an awesome school. I had, you know, great opportunities there as well. And I kind of mentioned that my route to what I'm doing now is also circuitous. So initially I went in, you know, you go into med school thinking that you know what you want to do in terms of a specialty, but it's very hard to know what you want to do until you get into your clinical rotations and start exploring the different specialties. So I went in and I initially, you know, thought I wanted to do OB-GYN, and that's what I matched into when I finished medical school. Did a year of OB, and then actually about, you know, really a few months in, I knew that it wasn't the best fit for me. So I, you know, still finished the year, but around, you know, the first couple months in, I started to look at other specialties. And that's when I found, you know, radiology and decided to switch into that specialty. So I think one of the important lessons to learn is that just be open to, you know, if you feel like something isn't a right fit, there are opportunities to change. Even no matter how far down the line you are, there are opportunities to sort of regroup and figure out what could work better for you. So that's, you know, something that we both had to do, I think. So
I actually want to kind of add a couple of things. We both had different situations when we were applying to med school. I think this is really important because the more people I've been talking to recently in terms of wanting to go to med school, the more I'm realizing how, I don't think people realize how competitive it is. And I tell them, you know, when I applied to med school, I applied to 30 schools, like straight up from the gun. Like at the beginning, 30 med schools, you're going to get, if they like you, they're going to send you these things called secondary applications, more of your essays. So I probably did maybe 15 or 20 of them. You know, they're long. So, you know, I would recycle my essays. But out of those whole, like out of the 30 places I applied to, I think I had maybe 8 interviews. And mind you, I also applied later. So I applied in October, and I think it opens in August or September. Mm-hmm. So by the time I had already applied, I already knew people who were already accepted into med school. So first lesson is apply first day that thing opens. Just submit that application, because you're applying for all the seats as opposed to like half or a third of those seats. So had those interviews. I went to 6 of the 8 because the last 2 I just didn't have any money. And retrospectively, like if I was an applicant now, I would ask my family or borrow money, because you don't know if that school is going to be the one that's going to accept you. At the end, I think in March, I was waitlisted to all the 6 programs that I interviewed at. I was waitlisted, and so I was like, man, I might not be going to med school. Like I remember that thought, and I was thinking to myself, what am I going to do next? And I started looking up teaching jobs because I was a tutor, mentor, all that stuff. I was like, man, that's going to be my backup for now. So do have a backup plan for if it doesn't work out. But, you know, fortunately, God made a way. Like I got off the waiting list at UCLA, and I was getting ready to matriculate. I already started doing the paperwork. And then a week later, University of Pittsburgh offered me a spot, but they offered me a full ride, like all my tuition covered. And so like that was a no-brainer. I was like, okay, bye UCLA, we're going to Pittsburgh. So definitely have hope. Like definitely have a backup plan. You know, it's not over till it's over. You know, like I have a friend who didn't get into medical school or didn't get an offer until a week before the start of med school. So you never know when you're going to get that acceptance letter.
Right.
You know?
Wow.
Just be ready. You just got to be ready, you know? Mm-hmm. You should tell them about she has a different story, and I'll let her talk about her interview process. Yeah. Yours is, she had a shorter, it was easier because she knew what she wanted from the jump. But the other part I want to talk about too is how, like, you know, going through school, I was usually the only black kid in class, or one of 2 black kids in the class. And, you know, I didn't think about how that affected me until med school, because, you know, when I got into med school, I felt like I had to always prove myself. And I was interested in plastic surgery because I thought it was cool. But I don't know if there may have been a point where maybe I didn't think it was cool, but I was just doing it now to prove that I can get in, because it's the most competitive specialty to get into. And I just remember after doing my 4 months of away rotation, so that's like going to different institutions and doing plastic surgery. I remember at the end of the 4th month, I felt really exhausted. And I was like, man, is this really right for me? But by that time, it was already time for application. So I just kind of stuck with it. But like I said, like I switched. But when I look back at things, I wonder, did I do plastic surgery, or did I continue to do plastic surgery because I felt like I needed to prove myself to others? Or did I do it because I truly enjoyed it, you know? So that's something that I want some of our audience to kind of think about, you know, because I know that most of you guys are constantly having to prove yourself. And at some point, you should, there's going to be a point where you feel like you shouldn't have to prove yourself to do what you do. You know, like you got to do what you want because it makes you happy, because it's what fulfills you. So think about those things when you're going through medical school and when you're picking out your specialty, or even when you're picking out your profession.
Yeah, I think it's certainly a different, perspective, just being a Black person in medicine. I think you always have that onus of feeling like you have to prove yourself. Just because people sometimes look at you and they think that you're there maybe because of, you know, affirmative action or whatever. You know, you get all kinds of strange comments, but you really can't let that get to you. You have to I feel like my motto was like, keep my head down, do my work, like do the best that I can do, and don't worry about what other people are saying or thinking. But I think it's especially hard if you're Black, because you feel like people are looking at you differently. You feel like you can't be the one that doesn't do well because you are Black. Like it's all of that you sort of carry with you. And I wish that's one thing that like had been discussed, or like I had the opportunity to discuss with someone before I started medicine, that was also going to be part of it. But yeah.
Yeah, a lot of good advice in both of your experiences.
Yeah,
you should write a book or something.
You should. Oh my goodness, have you guys thought about it? Writing a book?
Yeah. I kind of thought about it. But I'm like, I don't know if I actually would physically write it. I might have to record it, and have somebody transcribe
have like a ghostwriter or something. Yeah, for sure. Yeah, but your stories are amazing, and I love how you guys were able to overcome so many obstacles, and just keep pushing forward. I feel like a lot of us get stuck. I know we're getting a lot of questions through Instagram and email, and a lot of students feel stuck, and they might drop out of school, especially this year with COVID hitting. They feel like, oh, it's a gap year. This is my time to rethink things, and they're trying to figure out how to move forward, and they just feel like it's over. I can't go any further. I didn't get into the school that I wanted, or I didn't get the money that I needed, and so I should just stop here, right? And I love how you guys basically prove that mindset is wrong, and that you can overcome setbacks, and it doesn't have to look traditional or perfect, right, on paper. So thank you so much for sharing that.
And just to your point, though, like going the non-traditional route actually adds to the experience. I did sit in I interviewed for med students where at the University of Pittsburgh. I sat on the admissions committee for plastic surgery residency at LSU, same with anesthesiology.
And you're interviewing applicants.
Yeah, I'm doing that right now too. So it's kind of like I see what they're looking for, and sometimes when you do it the traditional way, like it just makes sense that you necessarily get everything that you want out of that. You're doing it in such a short amount of time. There are people who do that, and power to them, right? But sometimes we have questions about what we're doing, and some people will take a year off to explore what they want to do, and that's fine. I think when you do that, and you're, as long as you're being productive, it's adding to your experience. You have a new perspective to share with others. Half of my class at the University of Pittsburgh were non-traditional students. They changed careers. They brought so much insight into like how you work with a patient or communicate with people. Sometimes and actually we had quite a handful of students that had kids, and those people were they were like in the top third of the class. So I was like, wow, like how are these people doing it?
Yeah.
So time management, yes, that's what it is.
Yeah. So you don't have to be traditional, and I'm a firm believer that it's never too late. I don't care when you make that decision, it's never too late to pursue whatever it is that you want to do. Because if it's what you want to do and you're passionate about it, you'll always have energy for it. But if you're doing it because somebody else is telling you to do it, or you think it's the right thing, yeah, well, of course you're not. If you don't have the passion, you're not going to devote that time and energy that you need to succeed.
Yeah, for sure. So, what's one misconception about the path to medicine that you think most people have?
Yeah, no, I'll start by saying that I think the biggest one is that it's all about academic achievement. I think that especially pre-med students feel that the most important thing that you need to do in order to become a doctor is to get like the highest grades in all of your, prerequisite exams, the highest grade on your MCAT. But really, that's, in my opinion, not the most important factor in becoming a good doctor. So I think that we often find that we get bogged down with some of the numbers and like, I need to get this MCAT score, but it's actually not really true, and it's not really that applicable to being a good doctor. You have like your
I'm totally
take on that.
Yeah, for me, it's this whole meritocracy thing. I don't believe in it. Yes, you have to take those classes, and yes, we generally want you to score well. And if you don't do as well, like with your grades, then you got to make it up maybe with your MCAT. Like there's some give or take there. I actually know people who did very bad on the MCAT, but their grades were really good, and they had other things on their resume. So it's really the whole package, you know. So I think what makes like a great doctor, for example, is your ability to communicate with others. So that's one aspect. And like, how do you do that? Well, what do you do? Like, what are you engaged with? Like, there are activities that you do. Some people like do the check boxes, like, oh, they do a certain amount of activities, or they meet this picture. They're not looking at that. It's more of like when you do participate in an activity, how engaged are you?
Yeah, like how meaningful was that experience to you, and how did it inform your decision to become a doctor? What did you get out of it? How are you gonna bring that experience to your practice of medicine? I feel like all of those things you have to consider. It's not just about kind of checking off boxes, or I did this, or I volunteered here, or I did all of that. And I think we get too often bogged down in just making a checklist and saying I did all of these things, so I should, be able to get into medical stuff.
Exactly. And especially, I'm gonna say this to all the Black applicants out there, or actually not even just the Black, all the diverse applicants out there. Right now, again, studies are showing that we need you guys in medicine, and so that's a priority for med school. So I don't want you guys weeding yourselves out because you don't have the right grade. Again, make it up with your MCAT. There's other ways to show that you are a critical thinker, that you can communicate.
I think it's important to strive to get the best grades that you can, and try to learn the information as best you can. But that's not the end all. Like, you need to, there are other things that are important when they consider an applicant as
well. Yeah, I would say that people tend to weed themselves out. Yeah. That's, for me, like, I've noticed that people say, oh, I don't just have the right grades. And like, how do you know that? When you look at those, there's a book I remember that I used, and it had like all the average grades, the scores that you had to have for med school, and it broke it down for each medical school. Well, just remember, for every average, there's like about 50% that scored above, and there's about 50% that scored below that. What that combination is, you don't know. So that's why you're unique, and that's why you shouldn't discount your own experience. Again, I say this, you do your best and God will take care of the rest. You do your best, you're putting your best foot forward, things will work itself out. And maybe you get into med school the first try, maybe you don't, but that's gonna influence how you think about what you do next. So again, don't weed yourself out. If medicine's your passion, pursue it. And it may mean that you need to apply to more schools, or that's it. It's not just about the numbers,
No, because we've seen that even in medical school. The guy that like was really good at or scored the highest is maybe doesn't have the best bedside manner. Yeah. It's like these are important things to being a doctor. So grades are not all that there is. They're really not even the most important thing.
Yeah. Yeah, and those classes, those pre-med classes, they're not, they do build a foundation of knowledge for your basic sciences, but really the purpose of those classes are to help you think critically. And as a physician, you're gonna come into these different situations or new situations, and you have to think critically. That's all they want you to get from that, really.
I think it teaches you work ethic and to think critically. You need those things. But it's not about the numbers.
Yeah, and just to piggyback, I do know a couple people who were just pure, like, they had the highest everything, but they didn't have that social part. Your patients are not going to listen to you. And if you can't connect to your patients, you're not providing good medicine. So, yeah, think about what makes a good doctor.
Yeah.
Yeah, for sure. Do you find that you run into doctors that are missing a lot of doctors that are missing that whole social aspect that they should have?
People skills.
Just the basic people skills. Do you run into those? Okay. All right. So so if you're not a people person, you can make it too, right? I guess.
Yeah. But it's just gonna be different. I think that, like, for me, like, I'm such an introvert, so I think that was also kind of a little there are different personalities in medicine. I think we need all of them. You sort of have to find your niche that your practice that's going to best fit you. I don't know if that makes sense. But yeah, a radiologist, like for me, perfect as an introvert. I get to read images all day. I'm not like running codes. I'm like, I feel like I'm practicing medicine in a way that feels good and comfortable for me. And I still get to see patients. I still, do biopsies and whatnot. But I think you need all personalities in medicine. But no matter what your personality is, you need to be able to connect with your patient.
Yes,
like,
no, for sure, for sure.
No matter what.
No matter what. Yeah. It's yours, I think.
Yep.
Isn't it? Okay.
All right.
Hold up. I got hair in my face.
Fix the hair.
So professional. Sorry. Real life. Okay, go ahead.
All right. So if you had, what advice would you give to your childhood self or any other Black student who is either in high school, college, thinking about med school? What would you say to them?
Go ahead.
Mine is, I kind of alluded to this earlier. I have this written down here. So don't listen to the haters and the non-believers, because you are going to reap what you sow. Only you will benefit from, only you will enjoy the fruits of your labor. And then also you are the only one who's going to suffer the consequences of not fulfilling your own goals or your own dreams. So you just ignore the haters, ignore the non-believers. You got to believe in yourself. You have to be your biggest cheerleader, really. And then the other thing for me is when haters doubt, you prove them wrong. And that just means like use that as motivation to do what you got to do. Insofar as it helps you. If it's something where like if you have to prove them wrong and it kind of detracts from your goal, then you can ignore that. Just ignore it altogether. But if it's part of like if it's on your path to whatever you need to do, prove them wrong. And you don't have to tell them that either. You just prove them wrong, and they're gonna find out. So those are my two pieces.
Those are really good pieces of advice. Yeah, for sure.
I think we relate to that second.
Oh, that second one? Well. 1000%. We love that one. We live by that one all the time. It's great.
I'm afraid he was going to go Cardi B because that's his favorite thing.
Oh, no, don't do that.
There we go. Nice.
She has some good things like
don't even.
No, I'm not gonna do it.
We all love Cardi B.
Yeah.
I'm sure we can apply it to many areas of our lives. Yeah. I'm sure. But for this conversation, for this interview,
that's gold. Though.
Yeah, that is gold.
The one that I would say is to not compare yourself to other people. Yeah. I feel like that's the thing that really can interfere with you achieving your goals. If you have your mindset to do something, focus on it, figure out what you need to do to get to that goal, but don't worry about what other people are doing. And don't compare, how far you are compared to, or what other people are doing, to what you're doing and trying to achieve that same goal, if that makes sense. I feel like we see this especially among pre-meds because we're, they're often looking at each other's grades or looking at each other's MCAT scores. And you think, okay, this person has, for example, more extracurriculars than I do. Am I going to make it? And then you start to, again, doubt yourself. And I feel like once you introduce that self-doubt, it's the downhill, kind of trajectory. So number one, don't compare yourself to other people. Figure out what you need to do and focus on your goal and do it. And the other thing I would say is really, I always forget because I wrote it down. Let's see. I know you have something to say about
on my own competition. I'm competing with myself.
Yes.
That's going to be in the bloopers. That was good. Oh my gosh, that's hilarious.
Oh, no comment. I was gonna say is just regarding making mistakes. If you do make a mistake, I feel like one of the most important things that I would want to impart is don't dwell on that mistake. Figure out how to learn from it and move forward, and don't let that mistake become something that keeps you from continuing on your goal. Just try to take whatever you can, from it and keep going. But don't dwell on it such that it hinders you from progress.
Mm-hmm. No, for sure. Touching on other music artists out there, I remember reading something about Beyonce. Let's just bring in the artistry here.
Yeah.
And I remember as it relates, right? And so I remember her saying something like, if something upsets her, she'll take maybe a day to cry about it, and then she moves on from it, right? So I really love what Nancy said here. Just don't don't let it hinder you to the fact that you just give up on your goal, or even take months when you could have been, continuing, maybe finding a different solution or path to get to where you want to go. So I think that's gold too as well. Thanks, Nancy. That was really good for sure. Thank you. All right. So go ahead.
Just to add to that. So that's like what she mentioned is really important in surgery, because there are a lot of mistakes that can happen in surgery. And, surgery is known to be brutal, because like once you make a mistake, it's not just to you, like your whole team didn't know about it, and somebody's gonna like scold you or tell you about it. But after that, like you have to digest it. You gotta you have to take the gems from it. You gotta move on. You gotta still work with those same people, and you still have patience.
Like immediately.
Yeah.
I feel like in medicine you have to see that. You make a mistake, you have to just regroup and keep going, because you can't in the moment. You can't go on. You have to figure out what the next step is.
Oh, wow. Okay, so something that's consistent. So you have to have that skill no matter what. You have to know to get over something pretty quickly and move forward and find a different solution. Woo! All right. More power to everyone who's out there thinking about medicine. It's a great career, but with the tips here, I'm sure it'll be a lot easier to get to where you want to be. So we wanted to leave this time to ask a fun question. And then after, we're going to let Nancy tell us about her YouTube channel. What's the number one rite of passage you think all college students should go through?
I would say having a job in school. I feel like that really teaches you responsibility. Even if you, just do a couple hours here and there, I feel like it's a good way to figure out what life is going to be like, because you're going to be juggling a lot of things aside from just work. So having a job on top of your other.
Yeah, for sure. Some students are often caught in that college bubble, right? This is it, yeah. And everything's easy, and I could just go here to get my meals, and but just having that job and having that extra work ethic, I mean, that's real life. Once you get into family life and all that other stuff, work-life balance, and that's actually a really good rite of passage. I like that one. What about for you, Patrick? What's your idea?
So ideally, I would love for this to happen for like all college students, although it may not necessarily be the case for everybody. But maybe it could happen when you're in med school or some other time in your life. But I do think that it's good to go away from home, like maybe live on campus for a year at least, because I felt like in college, that was where I learned a lot about myself. My beliefs were challenged. I really got to learn more about who I am. But I'm far away that I can't go home, immediately. So like you have to learn to handle whatever situations come up, and you kind of learn to rely on some of your close friends to help you see things that you may not necessarily see. So yeah, I think living on campus, even if it's for a year, we're at Stanford, I'd say 99.3% like live on campus. Like almost everybody lives on campus at Stanford, and it was just a different experience, I know that may not be feasible for everybody. So I think, and for me, even though I lived on campus, I literally was 45 minutes away, even though I didn't go home that much. But I felt like I still had that experience of like having my beliefs challenged, and I had to think about what I truly believed in and how I perceived myself in the grander, in the grand scheme of things. So.
Perfect. No, that was really, really good. I thought we were gonna get like ramen or.
I feel like we're looking for other answers. Just like the freshman 15 and losing your keys and all of that.
I was the Easy Mac champion in
Were you?
freshman year. Yeah. Not now, no.
I met him when he graduated from the Easy Mac to what were ramen and pizza. We split Papa John's every Tuesday. Yeah, I remember that. Definitely. That was cool. Good time. Struggle meals.
Yeah.
All right. So we're going to leave this time for Nancy to tell us about her YouTube channel, where you can find her, all good hair tips. Go for it.
Yeah, so YouTube channel is called Efficiently Natural, and I started out my channel really as a hair channel, really as a way to figure out efficient ways and faster ways to do my hair while I was in residency training, and as a way to be creative as well. But I'm kind of, branching out and doing different kinds of content as well. So I have some, random, lifestyle type things. We also do a lot of medicine and mentorship content. So we talk about our journey through medicine on there as well. So you can find all of that.
Great. Well, thank you guys so much. We'll go ahead and link that in the description. Thank you so much for joining us today. And until next time, everyone, peace.
Take care.
Thank you. Peace out. Thanks for having us.